Serious fiscal challenges lie ahead, even as we are asked to play a bigger role in this healthcare reform. But equally important, we face a multitude of operational challenges. And that's because of this fast-changing healthcare world that we live in. And look, I don't have to tell anyone in this room, the new healthcare world is not something that's on the horizon for tomorrow. It is here now, today. And it demands our immediate attention. As he said, if you're not at the table, then you're on the menu. Healthcare is changing with new rules and regulations, new payment systems, new models of care. The change is driven by the Affordable Care Act, otherwise known affectionately by us as Obamacare. And as if you recall, last week, the entire healthcare industry is on fast track with the implementation of this reform. We can see the consolidations, the acquisitions, the mergers taking place in hospitals, providers and insurers rapidly trying to secure a position in this new marketplace environment. Community health centers have historically and will always be the safety net provider for low-income, high-risk, and vulnerable populations. But we cannot stand still, and you were talking earlier about TECHE. Our organization took this so literally, that's our name, TECHE Action Clinic. And on board, we always say that we don't stand in place, we don't run in place. It's TECHE Action Clinic. We cannot stand still while other providers actively move into our service areas and market to our patients. We have to be on board. To keep pace and to be part of this new system, it is imperative that we move not only forward to sustain our leadership, but also to ensure that the people we serve have access to quality and responsive health care. The kind of care that they need, the kind of care that every human being deserves. As was mentioned this past January, many of our health center leaders, board chairs, networks, and PCA directors gathered for our winter strategy meeting in Florida. We had intense, I underscore, very intense discussions about the operational challenges, issues facing health centers. Today I'd like to focus, this afternoon I'd like to focus, actually the whole P&I has been geared toward the key question we asked ourselves coming out of that meeting. Are you ready to act? Are you ready to be in a competitive future? Are you taking advantage of the opportunities now open to leverage your strengths as community health providers? Now I'm going to break this all down to you this afternoon, and I've numbered the 7 key topics. And if you're like me, I like to keep a running total and write those things down. Number 1 is the primary care medical home. 2 is system change. 3 is technology. 4, workforce. 5, public scrutiny. 6, integrated health delivery system. And 7, outreach and enrollment. Health centers in their years of practice have led the way and defined many of the components of what is called the medical home. Namely, patient-focused health teams, enabling support services, culturally competent care. But let me ask you this. How many of you have the steps, or taken the steps, to actually achieve formal recognition as a primary care medical home? Do you have that? Do you have the accreditation letter in hand, that badge of approval that would be required of you to integrate into the broader healthcare delivery system that we find ourselves in? I'll give you some statistics. Today we have 500 health centers participating in HRSA's advanced primary care demonstration. Some of you have been engaged in this or doing similar demonstrations in your state. Yet, as of last year, only 16% of health centers achieved recognition. 16%. This year, HRSA's goal is to increase that to 25%. But, forget who they're talking to. They're talking to community health centers. And what is that? Not only can we do better, we must do better, we will do better. I'm challenging all health centers to be recognized no later than 2015 as a patient-centered medical home. Why? Because accreditation is more than just a badge
ticket into the arena and will eventually become mandatory. So as always, we want to be what? Ahead of the curve. It's no longer an option. We own this issue. You know, at one point we had actually thought about self-accreditation. That's how much I think we own this issue of patient centered medical homes. So I'm going to ask you a rhetorical question. Are you ready to be a patient centered medical home?
Yes.
I didn't hear you. Are you ready? Those of you who are not, let's run it in place. Are you ready to be a patient centered medical home? Now, all right. Is your health center ready for vast system changes? Changes that will impact every facet of your health center business and clinical operations? That includes payment systems, new managed care requirements, shared saving models, common care organizations, quality performance standards. Are your board members and senior leaders prepared for a healthcare delivery system predicated on managed care principles? Some people call it managed money. The operational and clinical requirements that are needed to be successful. And do you have the expertise, legal and financial, to negotiate and manage contracts with payers? We operate in a very complex health delivery system where the foundation is what? Contracts. It wasn't in my contract, but you didn't put that in. So in negotiating these contracts, we must vigorously assert our place in our local systems of care to ensure our future. Number 3, are you moving fast enough adding technology, the information systems that promise to be the underpinning of health system reform? The Affordable Care Act is counting on IT-enabled providers, to drive and the drive that they're seeking for quality, innovation, and more efficient and improved patient care. And to that end, the collection, application, and use and exchange of clinical and financial data is essential. It's critical. It is needed not only to facilitate better care coordination, but best practices, but also to achieve cost savings. Make no mistake, in a competitive environment, HIT capacity is a must for healthcare providers. It will be needed to gauge and measure our strengths in comparison with other providers, and to produce hard data, demonstrating to providers and payers alike our value to the nation's health system. It's no longer enough to give a great anecdote. I always tell a story about when we started doing chart audits at our center, and you couldn't tell me that the quality of care that I was delivering wasn't superior, because I knew that. I knew all my diabetics were under great control. I knew that all were getting all the needed things that we should do for that population. And then our quality coordinator came and knocked on my door and started showing, let me show you your patient panel and how well you're doing. So I'm like, okay, just give me the good news. It was a very sobering reality, you know. Now I can point out some anecdotes of some people that we've done some things with, but the truth of the matter is, unless you have hard data and facts that you have to analyze and come to reality grips with that, you don't know how well you do it unless you measure it. So it's critical that we do that. Incidentally, and let me just give you this kind of puts it in perspective too. HRSA reports that FQHCs reached an adoption rate for EHRs of 80% in 2011. That's pretty good. 80%. I don't know what the private sector is. I don't know if anyone knows what the private sector is, but that sets us apart. But what doesn't set us apart is less than 50% of health centers have been certified in stage 1 meaningful use. Leaving money on the table. You've implemented the EHR, but you didn't go and qualify for the meaningful use component. So my question that I've asked is, why not? And when are you going to do it? This was not an easy process to implement. But we're leaving money on the table. We cannot afford to leave money on the table for work that has been done. That leads me to the next one. Workforce. That's number 4. Is your health center prepared to meet workforce demands, both current and future? Does your health center have the right combination of skills and the visionaries who can both do the job and move toward the change that we're heading? And I mean not only primary care doctors and clinicians, but also the IT experts, the financial teams, the CEOs, and the board members. Do you have the people who drive quality and improve and develop sophisticated business, clinical, management models to strengthen effectiveness and accountability? Do you have effective recruitment and retention strategies, leadership and career development strategies, and the collaborative workplace environment that will mark health centers as an employer of choice? You know, we had a lot of that discussion in Florida about being the provider of choice, but also the employer of choice. Do you have people, I mean, are you getting applications for people, and that was great what you said about the veterans. You know, are people coming to us seeking because that's a place where they want a career, not just a job? I know tough economic times, people want a job, but do you offer, does your center offer a career? Look at the employees that you employ. How many of them have been with you 10, 15 years? Or is your turnover rate 1 to 2 years? It's a self-examination that we need to do to really create the workforce that we need to serve the people that we serve. Is your health center engaged in the educational health center training our primary care workforce of tomorrow? That's different from the teaching health center. There's a task force being chaired by former chair, Lady Lil Anderson, on the Educational Health Task Force that comes in the workforce. And we've created a definition of that we'll be sharing with folks in the future. But a lot of centers, and I know all of you are doing it, we train medical students, we train nursing students, we train pharmacy techs, MAs. So you're an educational health center. As a matter of fact, if you look at, you know, we've always been involved historically in service providing, but NACC is taking on a greater role as we provide educational opportunities. Just in 2012, because of the Affordable Care Act, the Teaching Health Center program supported the training of 140 residents. And this coming year, that funding from the Affordable Care Act for Teaching Health Centers is expected to yield 280 residents. And these are caregivers that are going to carry the mission of primary care. That's our future. Now, not everyone is at the ready stage to be a teaching health center, but that's where we're going. That's the future. Are you ready for an era of transparency? I mean, that's number 5, intense public scrutiny. Jim McRae cautioned last year at the CHI that it's time that we need to take a look into the mirror and be prepared for that spotlight. And the reality is, what that spotlight shows, where the strengths or weaknesses will determine how centers are judged. As Dick Moore put it so eloquently several years ago, along with the spotlight comes the what? Searchlight. But I didn't say this to scare you. Instead, I want to tell you this to inspire you, to use those reflections to help you move forward to serve our patients in the best way possible. You know, we talk about spotlights. You know, if you've ever been in acting or a performer, or you've been involved in something, you want the spotlight on you because you want everyone to see what you're doing. And those of you who, you know, I know when people put makeup on, they get very magnified, and you know, you might look, you know, sometimes I go through that exercise, and I think we all do. We're blessed with longevity, and we start getting older. You start seeing things in the mirror that were not there, or you didn't notice before. The light's bright. Sometimes you might wonder, who is that person in there? Where did the old one go? But the point is, when you are doing the work that we do, and you do it very well, be not afraid. Be not afraid. You have a story, a good story, and a record to tell. Where would the folks be, what would the care be if we were not there in the communities that we serve? So I don't apologize to anyone. I think we need to be forceful in accenting the things that we do. Are we perfect? No. But have we improved over time? The care in the communities and the populations that we serve? Yes. So when people come with that searchlight, you control the agenda. You know, you tell them what we're talking about today, and you deal with all the other things, but you know, don't ever let anyone define you. You define yourself, and you show them the good work, the patient testimonials, you give them the anecdotes, and you use the data and prove your case. This brings us to number 6. Are you sufficiently helping your health center build the bridge into an integrated and coordinated healthcare delivery system that's going to be called for under healthcare reform? For example, are you developing relationships with the state and community health departments, the local hospitals, the subspecialists, academic health centers, and community providers? Someone said earlier about allies. We need to look at these folks not adversaries, but allies. Put the patient in the center and then surround them with all the things that we need. I mean, some of us are involved in a lot of different activities, but no one is involved in the whole process. So we need partners, we need collaborators. Does your team and board of directors fully understand that this is the future of the direction that healthcare is moving in? The old expression about no man and no clinic is an island, so we have to operate in that milieu. This is a patient-centered medical home. It used to be the model with the doc at the top and everything supported around. Well, now we have a service, a patient-centered medical home where everyone's a part of the team. Are you taking advantage of the trainings, legal and technical assistance now being offered by NACC and your state PCAs that can arm you with the knowledge to move toward partnerships, affiliations, enabling your health center to sustain leadership in this new healthcare world order? And finally, I'll argue most important, number 7, outreach and enrollment. How ready is your health center for the millions of people soon to gain health coverage, either through Medicaid expansion or the exchanges? People who will be looking for a quality primary care home. And what plans do you have in terms of marketing to prospective new patients while at the same time retaining your current patients? So let's not forget, an insurance card in hand, with that insurance card, our patients have options to go elsewhere. I always tell my staff, if you ride down the street and go to Highway 182 and you make a left turn, there's a McDonald's on the right and a Burger King on the left. And guess where all the cars always stacked up? At McDonald's. Now, I'm not going to comment on the product that they're delivering, but they're doing something that they're tracking all the business. At Burger King, you can walk in, actually walk-ins are welcome there. Okay. So I ask you, how are you approaching the patient care experience? We don't use the word customer service, as you know, anymore. It's the patient care experience. So what are your hours of operation? Are they convenient for the patients that you're serving? Are they convenient for your staff? Is your wait time reasonable? Is your center's environment comfortable? Do you have a live person answering your phone? Please don't call my center right now, because I think bottom line, are you treating your patients the way you and your family, the way that you would want you or your family to be treated? I think that gets back to that simple question. If you treat people the way that you want yourself and your family to be treated, then you know what a good patient experience would be like. And remember, the other big issue, enrollment in Medicaid. If your state elects to expand eligibility, our state has it, and several others that have it yet. But that process will begin as early as October, as Tom said, this year. 27 states have indicated their intentions. The rest of them are working on it, to expand Medicaid, or they're leaning in that direction. I've renamed our governor. I call him Governor Farrell. He won't let our people go. Just like Farrell, we're working on it. Every health center has a responsibility to make sure that patients and communities know about the new benefits available to them, and to ease some of the anxiety and uncertainty out there about these upcoming changes. We can do this, we have to inform ourselves first, and then we serve as the navigators, helping our patients to enroll the uninsured, those uninsured patients, and helping the general public, because they get misunderstanding too, understand the options in this marketplace, particularly as it relates to insurance exchanges. For that purpose, resources will be available from the states, CMS, and HRSA. So now is the time for you to closely watch what's happening in your state. Now is the time for you to really work with your PCH to ensure that you have the information to prepare to outreach and enroll in the next critical few months. Every state will have an exchange. Those exchanges will be for individuals to purchase affordable health insurance plans. It will either be operated by the state, by a combination of state and federal, or a federal law. In addition, new opportunities will be offered in 2014 to quickly, listen to this, to quickly enroll Medicaid patients on the basis of presumptive eligibility. All this represents a huge opportunity for health centers. If you do a self-examination, we'll talk a little bit about that later, of the potential population that you're serving that are uninsured right now, that there are tools out there that you can measure their presumptive eligibility, cue them so you're ready to roll when that does happen, when you're able to enroll these folks. You need a data banker on the front end so you'll be ready to take advantage of that huge opportunity to connect the people to health coverage. I know that we're all eager to do our part, and we have a lot on the table, and I've discussed a lot of things and a lot of challenges to address. On the fiscal and political fronts, now is the time. We've always had a voice, but now is the time to make our voices heard louder than ever before, and to engage around communities that we can bring strong advocates. We can be strong advocates and continue to be that voice for our patients and the health centers. We recognize that you can't do this all by yourself. We need each other, and as good fortune would have it, we've got our support organizations. NACC, state PCAs and networks, standing right here beside us to accomplish this goal. This week at the P&I, we have 12 educational sessions devoted to the issues of state reform, managed care, outreach and enrollment, quality indicators. There also is information on those of you that want to become patient-centered medical homes, no matter what the venue, be it Joint Commission, AAA, NCQA, all three of those organizations have information that can transform you and get you prepared to become it. So please take advantage of that. I know you will want to take advantage of those sessions and others. The specifics are on the handout you received. In addition, and I must commend the NACC staff, and I know you hear us say that up here, but I think there's a day at NACC that the membership committee, I think I saw they had that up. If you had the opportunity to really have a day at NACC and see this staff perform, it's just incredible. And then to have our Congress people, tell us on the front end that people are coming to them, high-paid lobbyists, powerful interests, with the respect that they have and the admiration that they have for the NACC staff is second to none. So, as we begin this meeting, let us begin with confidence in our ability to meet the challenge and to improve our future. Let us see this opportunity, not as a challenge, but as an opportunity. Let us take the course for leadership that's going to transform America's healthcare delivery system. And before I sit down, I ask you a rhetorical question. I'm just going to once again reinforce to you tomorrow. And I did this Monday when I was in my office. I saw 22 patients. And each patient had a story to tell. And I told them, some people I was ordering diagnostic tests and I wouldn't be available right then and there. And in the small community, people know everything about you. So yeah, I heard you're going to Washington. I said, yes, I am. I said, why are you going to Washington? I said, I'm going to Washington to tell your story. And the story with the couple that came in, both on Medicare and fixed income and a child that's disabled, that they can't get, it's been denied 3 times to Medicaid. And they were telling me that they still had $30,000 worth of debt that we were trying to pay off from a medical operation that the husband had 6 years ago. But the hope that they had, you know, and I was listening to them and we were talking and I was trying to offer some comfort. And the husband and wife both looked at me and said, Dr. Wiltz, every morning we wake up and look out of our trailer and we see the volume of the sun rising. And for that, we are just so grateful. Nothing takes the place of that. No matter what our troubles are, we're just so grateful to be alive and to have each other and to be in the community and to have the life that they have. They appreciate the simple things in life. But it's their stories. So when you're in there with your congressmen and your senators, it's the stories. Remember, it's not just it's the stories of the people that we represent that we're here to. So I'm going to close and just ask one more time: are you ready?